Hi, everyone. My name is Blake Cadwell. I'm the co-founder at Soundly.com. And today we're going to be talking about vertigo. And to discuss this topic, we have Dr. Amy Sorrow, who's talked about this with a lot of patients and studied this topic deeply. So she's going to help us understand what's actually happening in your body when you get that vertigo or spinning sensation. So, Dr. Amy, maybe you can just start by giving us a quick description of what vertigo is and maybe what it isn't.
Yeah, so vertigo is a very specific type of dizziness. Now, dizziness can be a lot of different things. Sometimes people describe it as lightheadedness or feeling off balance, feeling like they're on a boat, different types of sensations. And these can be related to the ear, some of them are not. Vertigo is a very specific type where it feels like the room around you is spinning. You have the sensation of rotary motion. And in most cases, this is related to the inner ear. Now, there is central and peripheral types of vertigo. We're going to speak more specifically about the peripheral one because that relates to the inner ear.
All right. So, can you take us into the inner ear? What's actually happening to create that vertigo sensation?
Of course, this depends a little bit on what is causing the vertigo, and I'll just mention briefly some causes that you may have. So, central vertigo could be caused by something in the brain, could be caused by something other than the inner ear. If there's any concern about, stroke or anything like that, of course, you want to get that checked out by a doctor and ruled out. The most common form of vertigo is caused by something called BPPV, which is benign paroxysmal positional vertigo. And other causes related to the inner ear could come from Meniere's disease, vestibular migraine, or vestibular neuritis. Those are possibilities, but they're less common. In the case of BPPV, which is most people with vertigo, there are these little particles that we have. So sometimes when we think about the ear, we're thinking about the hearing part of the ear. That's the cochlea that looks like a snail. Also, in your inner ear, you have another half of it, another part of it, the inner ear, where you have balance canals. You have three of these, and then you also have two other balance organs called the utricle and the saccule. What happens is you have these little pieces in the utricle. They're like little grains of sand. And sometimes they can get displaced and move into one of those balance canals. What happens is when you turn your head, the body normally perceives motion and it will then move your eyes to adjust. What happens with this particle is it triggers the sensation that your head is moving when you're actually in one place or you're not moving. And that disconnect between what you're perceiving versus what's actually happening, I feel like I'm turning, but I'm actually staying still. That causes that sensation of rotary motion or vertigo. And that's what's happening in that case of BPPV.
So, if someone wakes up one day and they have this spinning sensation, this rotary motion, what should they do?
Yeah, so as you mentioned, that is one of the most common times that people perceive it. If you're having that sensation where things around you are spinning for seconds to minutes, especially when getting out of bed in the morning or with head turns, it is likely BPPV. If you've never had this before, and especially as I mentioned, if you're having any other concerning symptoms, of course you should be seen by a medical professional and have that, properly evaluated. The best thing to do if you suspect BPPV is to see an ENT or physical therapist, somebody who's trained in handling BPPV and treating different maneuvers. For most people, it happens in what's called the posterior balance canal, not the other two. So that's about 90% of the time, which can be treated with something called the Epley maneuver. But in the off chance it's in one of your other canals, if you tried to do that maneuver yourself and you put it in the wrong canal because the particle can move from one to the other depending on how you move, you could actually make it worse. Which it won't cause damage, but it will feel unpleasant and it could make the vertigo worse.
So, there you have it. That is a quick tutorial on what vertigo is, what is actually happening in the body, and what you should do next, which in most cases is go see a doctor, especially if it's your first time experiencing these symptoms. Dr. Amy, thank you so much for your time. And to you, the viewer, we wish you the best.